Hi, I'm Thomas. Today I'm going to talk about the knee replacement surgery. Your doctor may recommend surgery to decrease pain and improve your ability to walk. But what's stopping you more often than not are the possible complications and the fear of surgery. Well, don't be afraid. Knee replacement is a routine surgery performed on over 400,000 people worldwide each year. Let's talk a little about the physiology of the knee. The knee is the largest joint in the body. The knee joint joins the thigh to the lower leg. The knee joint is composed of the femur or thigh bone, the tibia or the lower bone, and the patella or kneecap, which gives the knee its round shape. These bones are covered by cartilage, which allows for smooth, painless movement at the knee joint. Ligaments connect the bones and help stabilize the knee. When knee replacement surgery is recommended, there are two different types of knee replacement procedures your doctor may consider to relieve your knee pain: partial knee replacement or total knee replacement. However, it is still up to you to decide which process to have or whether to have the surgery or not. Non-surgical treatment such as pain medication, physical therapy, and steroid injections are available as an alternative. However, these are not as ideal and thorough to alleviate the problem. In the U.S., the average joint replacement patient is around 65 to 70 years old. However, it happens in all different age groups. For example, conditions such as osteoarthritis could be caused by an old injury or a chronic breakdown of the joint. In many cases, younger people, like sports players, get injured and need knee replacements. Therefore, this medical technology has really benefited everyone. The case of my friend Ed's bad knee was caused by chronic breakdown, which wore away the cartilage between the bone on his femur and tibia. In knee replacement surgery, the ends of the bones that make up the knee are repaired. The new joint works the way cartilage works in a healthy knee by preventing the bones of the leg from rubbing together at the joint. There are also computer-aided knee replacement surgeries for badly deformed knees. Luckily, Ed's knee surgery was much simpler than that. The replacement knees today will last 15 to 20 years. During the surgery, when the entire joint is damaged, a total joint replacement is done. To replace a total knee joint, a surgeon removes the diseased or damaged parts and inserts artificial parts called prosthesis or implants. The operation starts from an incision in the knee area. A part of the femur and tibia are then cut and removed where they join each other. The removed parts are replaced with a prosthesis, and the type of prosthesis Ed is using needed to be cemented to his bone. However, some prostheses do not need to be cemented. The bone surrounding the prosthesis grows into it and acts like cement. At the end of the operation, the skin is closed. A drain may be used to remove excess fluid. After surgery, rehabilitation treatment is critically needed, which prevents blood clots in the legs that can create pain and swelling, or even travel to the lungs and cause other potential problems.
My knee surgery, I think it really has improved my quality of life. I'm happy about it. I've been able to do a lot of stuff that I had trouble with before or had to at least put up with the pain. Now I don't have to put up with the pain. It's great. I only wish that I had done it a lot sooner. The prosthesis that they put in does not require any adjustment after the operation. It's true everybody has a little different knee, but they make many different models and sizes of knees, and the surgeon will look at your knee from the x-rays and the MRI and determine which model of knee replacement he's going to use, and he puts that one in, and then you're done. There's no replacement, there's no adjustment, there's nothing that needs to be done after he's finished. As soon as I got out of the operating room, I was back in my hospital room, they attached a machine to my leg that moved the leg back and forth and flexed the knee to get it started moving again right away. Then in subsequent days, I went to rehab, and at the rehabilitation center, they taught me how to get out of bed comfortably. They taught me how to walk up and down stairs. They taught me how to use the toilet, taught me how to get in and out of the shower. They taught me how to putting on socks by myself, because it's very difficult if you can't bend your knee to put on socks and shoes, so they showed me how to do that. I did this for a couple hours every morning and a couple hours every afternoon. And then of course I could practice on my own while I wasn't with the physical therapist. I understand that the total cost of the entire operation for the surgery and the hospital and everything was about $80,000. My surgeon says that his portion of that is only about $1,500. The rest of it is all hospital care and operating room costs and things like this. Now I was fortunate that my HMO paid for the entire cost of the operation. I didn't have to pay any deductible. The only thing I had to pay for was the telephone and the TV in hospital room and recovery period. So I was very fortunate. The operation was done on Tuesday, and I was finished at the hospital on Friday. So I was there for 3 days after the actual operation, and then my physical therapy took place thereafter. I happened to stay in the hospital and have the physical therapy done in the hospital. Some people have it done at a different facility, but the physical therapy lasted another week.
The ultimate cost for knee replacement surgery is specific to the hospital where the surgery is performed. How do you know it's time for surgery? You've tried a series of different medications that don't help alleviate the pain, or the medication you have been on no longer works. Choosing the right doctor. The most important questions to ask the surgeon are, how many of these surgeries have you done, and what are the risks involved in joint surgery? As with any surgery, you need to be informed with your options. Hopefully, the information presented here, in conjunction with that provided by your physician, you'll be able to make an informed decision.